I'm Brad Spiegel. I practice in pain management. Well, after completing college at the University of California, I went to New York State and I got my degree from New York Medical College. After I completed that, I came back to home, California, and I did 2 years of surgical residency at Cedars-Sinai Medical Center, followed by completion of my anesthesia residency and board certification at UCLA, where I specialized in cardiothoracic anesthesia, critical care medicine, and pain management.
Great.
My origin, or my true derivation for pain management, started a long time ago. When I was just a child, well, actually a teenager, my mother contracted or was diagnosed with breast cancer. At the time, we didn't have anybody in the family who was involved in medicine in any way. And so I didn't have any experience, but she was diagnosed with breast cancer, and unfortunately it was metastatic. It was to other parts of her body. And their doctors at the time told that she really didn't have much time to live. So she, on her own, created a multidisciplinary approach to her treatment, essentially. So besides going to the usual oncologist or standard or therapy, she had her own therapy also, which included meditation, yoga, daily exercising, very heavy emphasis on nutrition, and all these components combined together with the traditional therapy expanded her whole lifestyle and actually allowed her to live almost over 15 years. So from that really, right then I knew I'm going to probably be in medicine, especially I've seen the amount of pain involved too. I knew the pain management was for me also. As years went by, I just incorporated that into my practice because I just remember that my mom, living that long, she was able to not only live a full lifestyle, she was able to be at my medical school graduation. She went to a lot of other hallmarks. She achieved a lot of her other goals in her life. And even today, her philosophical strength is still incorporated into my practice.
Wow.
Pain, I mean, there's a lot of doctors out there who can just see a patient who are nice or compassionate, but overall, it's still not a true treatment of the pain. My philosophy on this is that each pain process is unique, just like the patient's personality is unique. So each disease affects the patient differently. We want to meet the patient. We want to spend time with the patient. We don't want to farm the patients out. We got to get to know the patients. Once we know how the disease is affecting them, we can develop a plan. So first imperative to me is I want to educate the patient. I want them to understand why they're having the pain, what the disease process is. Secondly, I involve the patients. I want them to be involved in not only the diagnosis, but the treatment plan. And following that, I just want follow-up. I want to be able to see how the plan is working, which direction to go next, change something, keep it the same. But by doing all this, it's important to keep the patient involved in the practice and into their disease process. And I think they do much better in the long run. What makes me unique, especially in pain management, is the multidisciplinary approach. I really want to, besides do the standard or the typical approach to the patient, more important is getting all the other facets of treatment possible, or at least available to the patient, which would again include everything from hypnotherapy, biofeedback, acupuncture, again exercise, and again, very important, nutrition. All these involved, I think, make my practice very unique. It shows not only concern for the patient, but the outcome really is tremendously better.